tissue. So when we have a state of our tissue or organism that we don't want, so we have a buildup of debris or maybe toxins in a certain tissue, and we want to get rid of that, we do a process akin to sort of burning, which then uses what is known as oxygen to create an inflammatory response to burn off that unwanted material and allow the body to remodel itself and create a newer, better tissue. So you see that in, say somebody's knee. So you have toxins or some disturbance of the knee, or you could, if you had something penetrate into your knee, so you have debris and you have metal particles, and then you use a kind of oxidation process to burn that stuff off and actually burn out the dead tissue. And that causes inflammation and pain and redness and swelling. So there's more fluid liberated during that process. And unfortunately, that's what in normal medicine is called disease. And so everybody's talking about inflammation and getting rid of inflammation, and inflammation is the boogeyman and the bad guy. But really, inflammation is just our body's beginning step in the remodeling. Once you've burned the logs, then you can build up a new tissue. So you burn out the old bad stuff that doesn't work anymore, and then you can use your body's regenerative powers. They're building new tissue to make a new and better knee than you did. And you can see the value of clarifying your thinking with this, because you can also then understand why certain therapies work and why certain therapies don't work. So therapies that don't work, let's stick with the example of you have pain and swelling and discomfort and immobility in your knee. And then you even have fluid building up. So there's something impinging on your knee that your body doesn't want. So it uses inflammation to remodel it. The conventional model, the conventional doctors misinterpret that and think the inflammation, not just conventional, this is also, the vast majority of alternative doctors, so-called alternative or health freedom doctors, who give you anti-inflammatories, whether it's Motrin or Advil or Aleve or turmeric or ginger or something. I'm not saying that turmeric or ginger may not help, but if they do it another way. But the point is they give you something to reduce the inflammation, and that's the wrong thinking. What you want to do is accentuate the inflammation, make the inflammation in a sense more effective, and help your body to get rid of whatever it is you need to make an inflammation in response to. And so that, therefore, you can see why something like stinging somebody with a bee or using a castor oil pack might actually work in a much better way to restore the health of the knee. The bee venom accentuates the inflammation, so it's more effective quickly. So you burn it off quicker, then you can remodel it quicker, and then you're restored back to normal health quicker. Castor oil pack essentially somehow sucks out or mobilizes or increases the flow of the fluids inside the knee, helping to get them mobilized. So the real inciting agent of this process is removed, and that facilitates the restoration of health in your knee. So these are two fundamentally different approaches to seeing health and medicine and the world. One is always suppressive, and that's why you end up with studies saying people have pain in their knee or so-called osteoarthritis. If they take Advil or Aleve for 10 years, they will maybe have less pain because it reduces the inflammation, but the deterioration of their knee will increase as compared to even if they had done nothing. So in other words, every time you do a counter therapy, a suppressive therapy, you're actually worsening the underlying condition and worsening the disease process. And that's basically the hallmark of conventional medicine, which is making every disease that you come up with worse so that, and the disease continues, which is exactly what we see because of a fundamental misunderstanding of how the human being works or any living being.